Well, hey everybody, it's Bram Duffee with Health Communication. We're talking about the provider's perspective here this week with Chapter 4 and Week 4 of class. And when we talk about healthcare, we often do hear the term provider nowadays. And it's like, who are we talking about exactly? And it's a pretty broad term when we say provider. But essentially, a provider is anybody who's in charge of your care. And that could actually be a paramedic who's on the scene of an accident, a nurse practitioner at your local clinic, a physician assistant, or even your family doctor. They're all providers. And the way that these providers communicate has evolved over time. And we'll talk about that. But I think that especially with the use of what's called mid-level providers, like folks who are nurse practitioners and physician assistants, this has been a much more common term to use the term provider. So there are three different kinds of models that our book talks about when it comes to how providers communicate. And throughout time, the old school kind of approach is the paternalistic approach. And I say old school because it's like back when the doctor is king, they lead the conversation, and the patient just listens and trusts them. And it's sort of like this parent child relationship where they do what they're told because the doctor knows right. Hence the name paternalistic. So that's one model. We also have this other model called the biomedical model. And it's more like when you and the doctor have a Q&A session together, mostly closed-ended questions. So the provider might say things like a closed-ended question like, are you experiencing any pain? Or have you taken your medicine? So they're trying to get concrete facts to help them figure out what's wrong. And the third model is called the biopsychosocial approach. And it's this one that's a bit more holistic. And I say holistic, not talking about herbs. I'm talking about holistic when we think more about the patient as a whole person, not just the fact that this is a patient who's diabetic or this is a patient who has a hip fracture. We're thinking about, what's important to that patient's life and what considerations might be special to them. And so in these cases, the provider would ask open-ended questions. And this helps when we think about asking open-ended questions, we get a fuller picture of the patient. So, it's like finding out about the physical symptoms for sure, but also about their lifestyle, their emotional well-being, their social environment. It's all about looking at the whole person, not just the illness. When we talk about these different approaches, because providers are taught to look at this. And I would say that especially now when there's concerns that come through about how does the provider make the patient feel through looking at that communication element that builds trust, and it also comes through in surveys. And because these things can be quantified and understood, we want to do better, especially now that we are in an environment nowadays where the patient is not in a position to blindly believe the physician for whatever they say. And I, as a healthcare provider, I think that it's fine, but at the same time, I want the most amount of trust for the provider that can be, because when I am a provider, I want my patient to not only trust what I say is true, but I want them to know that I want good for them, and there's a reason that I'm offering them, the good advice. So the thing is that not enough providers, just necessarily have these skills. They have to want to have them, and so times have changed, and folks seek advice from friends, family, and the internet. With so much information out there, it can be hard for some people to know who to trust. So it's crucial for providers to take the time to explain the recommendations and make sure that patients really understand. Nowadays, if someone doesn't understand or trust the doctor, then they may not actually follow the advice. And I've honestly seen cases over and over where the patient is told, you have got to do rehab. And because they don't do rehab, then they're not able to walk again. It's not something you can decide to do next year, right? It's a thing that is required right away. It's advice like not doing certain activities that are really dangerous for their condition, or not taking the medicine that they need. And so nowadays, folks don't have to do, we don't have to do what the doctor says, but we need to be, as healthcare providers, in a position to express that we're there to help patients live as long as they want to live. And that's one of the things that I tell folks in sometimes serious situations, is I let them know that I am here to make sure that you live a long time. So this is, these are decisions that result in longevity or not. So I sort of feel like that when we think about information that gets through to a patient, health literacy is a big component of that, because it has to do with how they're processing and understanding what's going on. And health literacy is all about helping patients make informed decisions. So, for example, if a doctor says, we need to remove your appendix, well, does the patient actually know what an appendix is? I mean, medical jargon can be confusing, and misunderstanding can lead to problems. That's why health literacy is so important. It's like this literacy stuff isn't just about reading and writing. It's also about listening and speaking. So we have to consider things like language barriers and mental development, or even attention disorders. When it comes to written materials, we need to make sure they're clear and they're understandable. And for some people, key points might need to be highlighted or explained. And that's why I commonly talk to patients about writing down what questions they have about what's going on for the doctor, so that when the doctor comes in the room, they can go through their questions, And the reason that's beneficial to have there is because sometimes in that moment, the information exchange can be shocking, and you're trying to process one aspect of the puzzle that you're being explained, but you miss the bigger picture. So those kinds of things can happen. And so we have to remember that people do struggle with communication. And so we, as providers who are helping the patient understand what's happening with them, it's important for us to explain things clearly and take into account individual needs and abilities. It's not always easy, but it's absolutely critical for good patient care. So patient-centered communication is a method of interaction in healthcare that focuses on the patient's needs, perspectives, and individual experience. So patient-centered communication, this is like an approach that encourages active involvement of the patients in their own care, and their own priorities are taken into account. And that way you build a relationship with the patient. And so there are some strategies that we can think about for how do patient-centered communication tools work. So one, you might have guessed it, is active listening. So when provider interacts, it's not just about hearing, but understanding what the patient's saying, right? So maintaining eye contact, just so you can catch verbal, nonverbal cues like nodding, or to showing that you're engaged, or to help with the full communication event, that can matter. Not just walking in and starting to speak, right? Because it helps with not just the communication, but with the understanding. And so, for example, if a patient says, I've been feeling really tired lately, well, instead of quickly moving on to the next question, maybe a provider who practices active listening might respond by saying, like, I'm sorry to hear that you've been feeling that way. Can you tell me more about when you started to feel tired, or what's going on, how it's affecting you? So this kind of engagement, you can see, can make a big difference in that connection that shows that shows that we're working to get to the bottom of it for your concern. Empathy is another thing. Expressing empathy helps patients feel understood and validated, and it can be done by just acknowledging the patient's feelings and showing concern. So, for example, if a patient is anxious about something, then an empathetic response might be something like, I understand that what's going on might make you nervous, and it's completely normal to feel that way. And we're here to make sure that you feel as comfortable as possible. So being able to anticipate that and notice those things can help with the patient. And then shared decision making. So it's like describing all of the treatment options with the patients, when you can give them pros and cons and making decisions together. That's a preferred method, because we want the patient to know what we're doing and why we're doing it. And so for a patient who's diagnosed with high blood pressure, for example, the physician might say, hey, we have a few different options for managing your blood pressure. We could start with lifestyle changes like diet and exercises, or we could consider medicine. So, what do you think is best for you? Do you feel like that you really could do a diet and lifestyle change working out, or do we want to try medicine, or both? So being able to just discuss that is something that can pull the patient's perspective. We do things like use lay language, instead of using hypertension, we can say your blood pressure is high, and there are patient-centered communication really allows providers to help the patient feel more comfortable. And yes, involved, but they can also be empowered in their healthcare in a way that's important, because the last thing that we want is for them not to get it. I am commonly, like a lot of folks, I'm commonly concerned about my patients falling. And I can tell you that for most people who go to the hospital, they're used to being independent, like getting up to go to the bathroom or getting up to grab something or to get their cell phone. And I learned to tell the patient why I'm concerned about them getting up on their own, right? Because they might need that reminder, right? So if everyone just says to them, I want you to call someone before you get up. Don't get out of bed without getting up. You hear that 2 or 3 times as a patient. That's a lot different than